So I'm Robert Yates. I'm the Executive Director of the Centre for Universal Health at Chatham House in London.
Thank you so much for this opportunity. So you, in your work at Chatham House, you have supported a number of countries in achieving universal health coverage. Could you share some examples of how some of those countries have achieved universal health coverage and some key learnings for Nigeria?
Yes, we specialise in the political economy of universal health reforms, recognising that to move to a system whereby everyone gets all the health services they need without suffering any financial hardship is a very political process. Obviously, you have to get all the health systems reforms right in terms of the human resources and the medicines and the infrastructure, but to create, in particular, a financing system whereby rich people subsidise services for the poor and the healthy people subsidise services for the sick is a very political process and requires smart politicians making sure that everyone benefits from those reforms. But there are interest groups, I think, that are often opposed to that, you know, sort of maybe people who don't want a publicly financed health system. So we see right across the world, these are quite difficult political things to get off the ground. So a lot of the advice that we're providing is of that type of nature, really advising political leaders about the great opportunities that there are in introducing UHC and advising them some of the tactics they might employ. And we're doing this at all income levels. We're advising people in the United States on this, and in Europe, in Ireland, but right across the world, all countries are moving in this direction. We're also advising in South Asia, Sub-Saharan Africa. So everyone's on the same journey. What we're trying to do is provide the political advice to complement all the technical advice that's being provided as well.
Yeah, absolutely. And I'm sure there are some key steps that you recommend to these countries on what they should do to speed up, to accelerate, achievement of universal health coverage. And you've also worked extensively in Nigeria as well, and you have an idea what the key gaps are.
Yeah.
And one of the most predominant conversations that I usually had is how limited resources are to start with. How can we make a case for the investment of our resources, our really scarce resources, in health?
Yeah.
Especially as we build up towards the 2023 general elections in Nigeria.
Sure. And you're right to very much focus on the financing, because if the financing is crucial, if you don't get the financing right, you don't stand a chance with universal health reforms. So it's all about replacing private voluntary financing, and that really means people paying for health services over the counter. Very high out-of-pocket expenditure, which is the situation you have in Nigeria at the moment. Replacing that with public financing. The only way to reach UHC is through public financing. And this is quite feasible to do and often requires an injection of about 1%, maybe 2% of GDP into the health system to reduce or if not eliminate the financial burden on households. Now that's a bit sort of technical language for saying you provide free health services. The government provides free health services for everyone. And this was a step the United Kingdom made after the Second World War, that in the birth of our National Health Service, the government stepped in to increase public financing and say to the population that you no longer have to pay to see a doctor or access medicines. Now, that amount of financing is quite a lot. I mean, let's be realistic here. 1 or 2% of GDP is a lot of money. But we have seen countries do that, even at times of financial hardship. So one talks about scarce resources, and it's always difficult to increase public financing. But we saw with the COVID pandemic how, faced with a full-scale emergency, governments could find money for health. We're seeing with things like the conflict in Ukraine at the moment, sort of countries finding money to help support Ukraine and deal with other crises coming along. So I think it is a case that there will be fiscal capacity, there will be space to find that type of funding, we need to encourage politicians to recognise that this is a smart thing to do, not only to improve health indicators, but build the economy, reduce inequalities, and dare I say it, the most obvious thing being it brings huge political benefits. People really, really do appreciate the government stepping in and providing health services. So this might sound sort of brutally honest, there are big votes in this, that, that if you do this, then potentially you're going to become more popular and more likely to be elected, or if not re-elected. So I think that we should be upfront, and we're entering a very political season at the moment in Nigeria with the elections coming up. So I think in many respects, we go route one and say there are huge political benefits in doing this.
Absolutely, yeah. And I mean, you mentioned the key political window that we're going into right now and how to make a case for universal health coverage. So we've talked about politicians themselves and how to encourage them to invest in healthcare. What about the citizens? How can we empower our citizens, the Nigerian citizens, to demand for increased political commitment and accountability towards universal health coverage, resilient health systems, primary health care during this political window?
Well, I think it really is a matter of raising awareness in the population that it is perfectly legitimate and in fact normal in the rest of the world for the state to have a much bigger role in health financing. That I think if you've perhaps grown up in a system where you don't have that expectation, and if you get sick you go and buy medicines and you have to pay money to see the doctors, you sort of perhaps might get used to that and just think that that's the norm. But what we've seen right across the world, and it tends to spread through regions, are smart politicians recognizing that households are really suffering, that they are forever worried that someone is going to fall sick, that the health implications that has for the family, but also the financial threats that poses, that you can throw you into debt. I know there's the situation in Nigeria that some people are detained in hospitals until their families find the money to pay their bills. Believe me, that is not normal. That is terrible. And I think to raise awareness in the population that they should expect more of their political leaders to take that burden away. This is very much, I think, sort of part of the work that CSOs can do and the media can do as well. And I think we have seen some examples in Nigeria of some state governors recognizing that they really can help their populations through providing free, if not subsidized, health services. And I think working with those political leaders to say this is feasible in Nigeria today, and just changing the whole dialogue so that the population begins to think, well, we should have this. And if you have it in countries like Sri Lanka and countries like this that have got similar income levels to Nigeria, then why shouldn't we have this here? And so that's where I think we should be going on this, really to empower the population to raise their expectations that this is a right and proper thing for their governments to do.
Absolutely. So raise the public's awareness, identify political champions.
Absolutely.
Who have done it and who can then push for it to be done at the national level. So you published a piece in the Lancet Journal where you showcased historically how universal health reforms have been born out of a crisis. Mm-hmm. So what opportunities exist for Nigeria to implement universal health coverage reforms as a key lesson from the COVID-19 pandemic?
Well, I honestly think that Nigeria is in a very, very good position to race ahead with universal health reforms. If you look at the basic statistics at the moment, for its income level, Nigeria isn't doing well. I think that's sort of pretty common knowledge. Extraordinarily high levels of out-of-pocket spending, people not accessing health services, very poor maternal and infant mortality statistics. You know all these things. So I think the population recognises that you have got a great opportunity to improve. But as well, I think that you've demonstrated with the COVID response and also the great work that organisations like Nigeria CDC have done, that there is the capability and ability in the country to do something about this. So there is the sort of the track record, the little green shoots of developments to show that this can be done here. Also, you have the resources in the economy. That if you look at the GDP per capita, which I think is in the order of about $2,300 per capita, that is higher than Thailand's was back in 2001 when it launched some of the most successful universal health reforms the world has seen in recent decades. So there is money in the economy, and I think we recognise a lot of that is tied up in oil revenues and the natural resources that you have here. And it would take a very good and strong politician to be able to access those types of resources. But it's not as if you're a desperately weak economy that you haven't got the money in the economy. So you have the space in the economy to do this. You've got a track record, and most significantly, you've got elections coming up where political leaders are looking to do the right things by their populations. And my recommendation for any political leader campaigning, be it at a state level, at a federal level, is go for universal health reforms. And leaders emerge who do this. And we've seen it happen in Indonesia. We're seeing it happening in India as well at the moment. So I think there is this great potential for this to happen in Nigeria, certainly within the next 5 years.